A very good afternoon to all the distinguished guests present here today, or the officers and staff of the Health and Family Welfare Department, the guests, and everyone present here today. Our Principal Secretary, Sir Sampat Kumar, has just presented our Honorable Chief Guest with a traditional Vindhya. So before we go ahead, I would like to request our distinguished guest to please come up to the dais, the Honorable Chief Minister of Meghalaya, Shri Conrad Sangma, the Honorable Minister of Health and Family Welfare, Madam Ampreen Lingdor, our Principal Secretary, sir, is already here. A Secretary of Health and Family Welfare, sir, is already here. A Madam Deputy Commissioner of East Khasi Hills, Madam, can you please come up and be here in the dais? I will also like to request our Director of Health Services, MI, Madam H.C. Lindam, to kindly come up to the dais, please. And also the Director of Health Services Research, Madam R. Lingdor, to also come up. So we are all gathered here for the state launching of the Ayushman Bhav campaign. And this term is, actually a blessing for a long and healthy life. It is a very favored and well-loved blessing of the elders on the youngsters, and they usually say, "May you live a long and healthy life." And no one can have a long and healthy life without good health. With this in mind, the Ministry of Health and Family Welfare, Government of India, is organizing this campaign to enhance the awareness of healthcare schemes in both rural and urban areas so that each and every citizen of India will be blessed with good health and long life. So on this positive note, I now request the Secretary and Mission Director, Department of Health and Family Welfare, Government of Meghalaya, Sir Ram Kumar, to kindly give the welcome address.
Honorable Chief Minister, Shri Conrad K. Sangma, Honorable Health Minister, Madam Ampreen Lingdo, respected Principal Secretary, Mr. Sampat Kumar, the Directors, Deputy Commissioner of East Khasi Hills, Madam R.M. Kurba, the teams from this district key managers from NHM, district program managers, MHIS, ASHAs, ASHA facilitators, village health councils, the whole state nodal officers, NHM team, various nodal officers from the districts. A very, very warm welcome to one and all present here. I welcome you wholeheartedly for this very, very important program, which is also a campaign launch, who have come from across the state, from all the 11 districts, all the 12 districts, who have participated actively today. Sir, Ayushman Bhav is healthcare for health and wellness for all. So we wanted to ensure, as per the vision which has been communicated in our state health policy in 2021, we would like to take healthcare proactively to people. This is an opportunity, which is a nationwide opportunity, where we are trying to utilize the same. The campaign technically is going to be launched from 17th onwards to 2nd of October, where three main agendas are there. One is for ensuring every household, every person who is above 5 years of age to have a registered PMJY MHIS card, and to have an Ayushman Mela in all the health and wellness centers, as well as the primary health wellness centers, where we will go about non-communicable disease screening, TB screening, and for various other diseases proactively. Number 3 is called Ayushman Sabha, or the Village Health Council meeting, which is expected to happen on the 2nd of October on the final day. This initiative is to take people's movement, health as a people movement. During COVID, we realized that it is not going to be sufficient to keep health within the health centers. We have to take health to the public, and that is why we had started the village health councils. Today, the number of village health councils from a couple of years back, today we have almost 6,758 village councils, almost saturating to all the villages, about 7,000 villages we have in the state. We will also start the urban councils, health councils. The bank accounts, we have about 4,331 bank accounts have already been formed. We are told that we are getting close to 5,000 bank accounts of the 6,758. Close to 10,000 plus meetings, and recently 5,730 meetings of these village health councils also has happened, sir. I'm very happy to inform that this community participation, which is very inherent to our state, is coming up very well. Today, we have about 150 plus village health council members from various village health councils across the state. I'd like to extend a special welcome to all of them. Under MHIS, we have already touched about 71.74% coverage, which is about 4,93,975 households, with a total members of 18,26,820. We also ensure this year, MHIS 5 from September 1, 2022 to August 31st, 2023 has been the year with highest MHIS claims, thanks to a lot of the awareness which has been created and a lot of registration which has happened. Despite the minor issue of having an Aadhaar linkage, this year has been the highest in terms of MHIS claims. I'm very happy to announce it, but there is a bit of a way to go in terms of Aadhaar coverage. We have to achieve the 100% from the present 21.12%. In terms of tuberculosis, 4 of our districts have got, 3 of the districts have got bronze medal, and 1 district have already achieved silver medal in terms of TB eradication. I would like to wish them again today. And other 3 districts, the old TB districts, will also be able to eligible for the medals for this particular year, and we hope to achieve the same. Sir, we are taking this opportunity to create that awareness, to propagate the vision of community involvement. Our state has a lot of health related issues, which from various things, but we have made a lot of progress in the last few years. We would like to continue it, and that is one of the main reasons we are having the program today. With these few words, I would like to welcome all of you once again. Thank you for your presence, from ma'am and everyone. Thank you.
Thank you, sir, for your warm welcome and on enlightening us on the concept of this campaign. And also, we are happy to hear the positive news in the progress in certain areas of our health sector. We will now be favored by an address by our Principal Secretary, Health and Family Welfare Department, Sir Sampat Kumar. Sir.
So good afternoon to all of you. I would like to pay my respects and greetings to our Honorable Chief Minister, Shri Conrad Sangmaji, and our Honorable Health Minister, Madam Amperin Lingdo, and my colleagues, Mr. Ram Kumar, and all the directors who are here, and also the DC Shillong, and more importantly, those who have come from all over the state, they representing our traditional institutions, village health councils, and also I can see a lot of missionaries are here. So I also would like to extend a warm welcome to all of you. Today is a very important day, and it's a day for reflection. So this is something that I wanted to tell you. Meghalaya has been talking about this Ayushman Bhav. What is Ayushman Bhav means? It's essentially long live. How actually we can increase the life expectancy, our healthy life expectancy. That means like not that like, you live for a longer period with medicines, but how can you actually live for a longer period with good health, without much pain or, much problem. So for this, I think you all aware, I think the state government has brought It's a first of its kind state health policy in 2021, where in fact I think Meghalaya is perhaps is the first state in India to come out with this policy, which talks about not only health means not only curative health, health means preventive health, health means enabling health. So a three-dimensional health policy was brought in by the state, and the state started investing a lot on building the systems. One of the important system that the state government has brought is the village health councils. Today, we are looking at the village health councils in every village. They are elected bodies. Again, this is the first of its kind in the country, where you have elected local health bodies involving the traditional institutions to take care of the healthcare. So this is a very important thing to celebrate. Besides that, I also want to tell you that in fact, Meghalaya is also one of the states which is also investing a lot on health budgets. So generally, the Meghalaya's in the budgetary support, around 8% of the state budget goes on healthcare. So it's the highest in the country. Many, in fact, along with that, Delhi and few other states are actually on the top, top four, top five. So this is again the idea is that unless we build the human capital, we cannot really see the overall development. So with that motto, in fact, our state government also has brought a kind of a life cycle approach. What is the life cycle approach? Is that how can we actually support at a different stages of the life? At first, the early childhood development period. So that's again a very important period. If we, in fact, the state government has launched early childhood development mission. The idea is that how actually the children are given very good support, not only from the centers like Anganwadi centers, but also by the parents and various community institutions. So one of the idea is that if you really put a lot of effort during that early childhood period, we can actually see the results at later point of a time, because the children's cognitive capacity, their intelligent quotient, everything will improve with if you focus on the early childhood period. Similarly, there is another idea is that how to support the adolescents and then how to support the adults. So here, as a program, I think you all aware, we have as far as adults are concerned, we have to do a lot of work. That's where the village health councils have to be mobilized to ensure that how actually we can bring in positive health seeking behavior from the communities. I'll give one example. Every pregnant woman has to go for 4 antenatal checkups. If they go for 4 antenatal checkups before the delivery, she will be safe. And for every 1 antenatal checkup, the possibilities of any maternal mortality rate will be reduced by 12%. So here again, village health councils have to really talk about it. What is the importance of this entire health seeking behavior? So this is where we can actually extend the life. So if we can ensure that every child is taken proper care, every mother is taken proper care, and every adult is properly counseled. And again, I'm coming back to the adults. Over 55% of our adults over 15 years age, they are smoking. So again here, this is again an important challenge that we have to take up at village health council level, how to reduce the tobacco consumption. If we don't reduce the tobacco consumption, it can lead to the cancer. It can lead to so many other diseases. So there's a campaign, this is the program is that we really have to involve everybody to tell that one how actually it is important to take steps on the preventive health care by using a lot of this entire the resources that are put at the disposal of the health department and also with the village health councils, through which actually we are able to increase the healthy lifespan of the state. That's with that vision actually we are this entire program is being organized. I really thank our honorable chief minister for his visionary leadership, who actually has been talking about this entire life cycle approach for development. So if we build the human capital, we can actually create economic development well at later point of a time. So a lot of focus is being given by investing in this entire health, early childhood development, and also adolescent health development, and also you all aware there is the Chief Minister's Safe Motherhood Scheme, through which all the pregnant mothers are given full support, so that like they would not actually have any problem. Because of this program, we have seen about 40% reduction in the maternal deaths compared to the previous years. So this is again a very, very important steps that are being taken here. Actually, there is a need for both the government functionaries and also the missionaries who are working in the health sector, and also the traditional institutions and the village health councils and the self-help groups coming together. We should work in a collaborative way. We should really demonstrate a good collaborative model and see that Meghalaya becomes like a Kerala, in terms of the health indicators, where Kerala has achieved single digit IMR, single digit MMR. Similarly, Meghalaya should try to become like a Costa Rica, where the life expectancy is 81 years. In fact, it is greater than the United States of America. So that is the kind of a vision with which we should work, and it requires a participatory approach. It requires a collaborative approach. I think we would be able to achieve this one with all your support. And with these few words, I would like to say again, thanks, and also appreciate the NHM for organizing this event. Thank you.
Thank you so much, sir, for your zeal, your leadership, and your enlightening speech on preventive healthcare. And of course, sir, you have brought it into action. We will now have the launch of the Village Health Council, that is the IEC book, the register, and the VHC app. I would like to request our Honorable Chief Minister, Honorable Health Minister Madam, or Principal Secretary, or MD Sir, or DC, and also the two DHS who are here with us to kindly join with us as we launch the VHC app. I would also like to request Dr. Mary and her team to kindly come up.
We shall now have the launching of the IEC book and the register. These IEC materials are made available in all the local languages, that is Garo, Khasi, Panar, Bengali, besides the English. They are to be used by all the VHC members all across the village health councils during their meetings. Thank you, sir. Thank you, ma'am. Ever since the Village Health Council have been rolled out in the state and its formation took place in our villages, there have been noticeable changes and gradual impact taking place among the communities. We shall now hear briefly the testimonies of some of our VHC members who are representing the regions of our state, that is the Khasi, the Jaintia, and the Garo Hills region, on the impact of Village Health Council upon their respective villages. Now may I call upon Shri Miki Lingdo from Tuber Khmaishnong VHC, East Jantia Hills, Shri Shonroy Rinja from Lightkerhong VHC, East Khasi Hills, Shri Rongsel Momen, Baksapara VHC, Southwest Garo Hills, to come upon the dais one by one and take the time. May I call Shri Miki, followed by Shri Shonroy, followed by Shri Rongsel Momen to come up to the dais, please.
Good afternoon. First of all, I would like to thank DNHM who have given me this great opportunity to stand here on this grand occasion of the launching of Ayushman Bhav. I am Sri Mikilungdo, headman as well as the chairman of Tuberk Machnong Village Health Council under Wapung and C and RD block of East Jantia Hill District. The Village Health Council Committee in our village was formed on the 7th of June 2022. To be honest with you all, on the first meeting of our executive members, we have no idea how to run this VHC committee, but through the district administration, especially our DC, Sir Abhilash Barwal, who has guided us and informed us of various how to run and how to look on this special community. During our VHC community meeting, we asked the members, we used to talk about various health issues concerned in our village. We discussed because, as you know, health issue in all our country, we found that in rural areas there is malnutrition and various sickness, especially to the newborn child and pregnant women. We, from the members of VHC, we used to go for regular home visit, especially when we came to know that there is high risk pregnant women. We will go to explain, to make them understand that they should take care of their health, especially for their new unborn baby. We explain them the importance of antenatal checkup, and we insist them, we explain them that they should go for institutional delivery. We used to talk mainly on this nutrition topic, and we explain to each and every family we used to go for regular home visit. We also talk about maternal death, so that each parents in our family, in our village, they will take it seriously by doing maternal death review. Whenever we go for home visit, we take that time is as precious for us because we get to flash there's various scheme which our state government has implemented, especially the Chief Minister Safe Motherhood Scheme and the PMMY, VY, JSY, and Mega Health Insurance Scheme. We have achieved 100% routine immunization as all of our mother in our village understand that their child should immunize for a healthy baby. With the formation of this village health council, the committee and each members in our village feel the sense of ownership and responsibilities over our village regarding the health status. We are trying to conduct more activities in near days to come so that every individual, every household and community at large will consider health as the first priority. Everyone good as for life. There is a saying, health is well. With these few words, I conclude my speech. Thank you, everyone.
Te hawaning kong hakanika singi ka bamantang pan pau chu song kemen hadu kata bang yo ban don kat hakanika por kat I chief minister badan borom jungi ngai play yafi sir kamtam kamjoru yai I health minister jungi madam amprin lendo I belong imitri jong kanat ka Koit ka Khiah Principal Secretary Mr. Sampat Kumar, Mission Director Sir Ram Kumar, Jogtanat ka Koit ka Khiah, but Baroh ki bidon lang hangni. Ngai kublai kerpang ru, ya Baroh ki nagalang ka tanat ka Koit ka Khiah, ka Health Department, but kumjuru ya Baroh ki VC members. Kandiat Hawidei bat kanigasngi ngapan pau ju sukmen man yathu ipi ba ngila form ya ka laj krong village health council ha ka khat sau tarik jomnai September 2024 hangni ngakwa ban pau ju sukmen hadu kata ba hadin ba ngila form ya kanika village health council shibun ki kam ki ba ngila le hagni ka shnong jongi lamba jong gani ka council daisha ka jingdon jong ni ka jing council kalong ka jing khu ko bukhraw namar balai ba harin bang la form ki council ni la le shibun ki kam la banong bang la le bin le ki home visit namta ki high risk mother namta ki vaccination reversal but kumjuru ya ki baklak children ni so komen ru ban yathu angne bat pan pau ru ka jing so komen hadu kata bahadin bangila de form ga ka village health council ka snong jungi sungom nai khublai kerpang I chief minister badan borom jungi bat kumju madam amprin lendo menteri ketenat ka Koit ka Khiah bangi layo ban sna ya ka sab sanchar ha kisnong jingi lamba ka scheme PM abham kublai shibun sir kublai shibun madam ni kermen skemru ba rengkat ka jing trelang bat phi ka trat ka Koit ka Khiah na koi ka por koi pot ngin yo ban penlong ya kisnong ka thau ka jungi ka balong ka banlaj na jing pang ba pher ni kularu khmat jang phi bangin ya tre rengkat bat phi ka government bat phi ka tanat ka Koit ka Khiah kumjuru khani ka singi pen pau ga jing smok men hadu kata ba mata singi sakhi ba nilayo ban lunch ya kanika Ayushman Bhav tenamar kata ni kremes kem ba mengi komki VC members rengkat bai kita hilang bat ka tanat ka Koit ka Khiah ngila ban ra ya gari jungi khamtam ka state jungi ka hapleng ga jing Koit jing Khiah ka babit babyang habaro kiliang kublai shibun
Tengtang saya semuanya, ni nampi kita salam ko sakantinan, nak kata ku siung matia sakantinan salam, aru sakantinan good morning. Yasomni bako mandira ko manna krabi pa chingni adok ni chief minister pa Conrad sangma sir nang ko ba hangni nambi pa salam ko na ta kuchung mata wanda kia health minister madam Amperin Lingdo nang ko ba hangni nambi pa salam ko na ta kuchung pia wanda kia somni bako angni bimun ko rongsel ji mumun mga aro anga ba chonbi pa southwest Garo Hills ni sombi pa baksapara songu ni onga aro angni 송우 angni baksapara 송우 anga BHC ni secretary onginga 증아 증리 BHC council ko 하절근니 골근니 측흥 아고스타리코 아바칭아타 메벤 증리 측흥 아바칭 무등랑오 증아 아디단 닉닉간이랑코 만나로 자자니랑코 만나하 메벤 council 나니만 증리 녹마랑 블롱엔 자자니코 만난디바 증리 authority랑 바 증코 들링pa officer랑 health nigta aruba medical nigta aro block nigta 증코 제랑한 리들링 좀 와망 송랑 지렌 바네 증나 아리타 트레이닝 랑코 나하 아루바 아리타 스키 답반이 랑코 나 비벤 증아이노 야 BHC 니 남근이코 마신바 야 BHC 코 굴리에 아로 맨나 야 BHC 증나 블롱엔 낭 총무트 바오 nga 맨나 증니 송랑오 health nigta 블롱엔 자만 찾긴 바 만드랑 송니 만드랑 동아점 우니기만 야 BHC 코 증아 굴리나다 낭늑종다 especially 송오놓고 송동인 급바 만드랑 마급바랑 이제 와망 health 니 자만 찾간이랑 랑 마이나 와망니 놓고 홈 딜리버리 가 아니랑 아르바 중화갔다 와망니 안노동 무등어 비지슈 아니랑 중자 아르바 아치금은 비서랑 와망 중화갔다 틱탁 옹에 비지슈 아니랑 옹제마이나 송오노고 동그랑디 안탕탕니 감코산 딸릭바타 비지슈 아니코 아로 이니 남근이랑코 마시자 오니기만 야랑코 늦게 증아 야 헬스 카운슬코 굴린바니 하이타 야랑 카운슬니 그다 야랑코 등탕았나 나바 동아 니 찬친바니 비빈 증아 정리창 증리 MFC 빌딩오 증리 송니 MFC 빌딩오 빌리지 헬스 카운슬 아로바 아사 안간와디 아로바 체어맨 코 체어맨 압산 둘리 미팅엔 바니 장니창 야 만디랑치 제랑한 호스피탈로 딜리버리 옥나 공쟁에 야 맞다가바 만디랑치 리앙엔 바니 장니창 와 먹나 남급파 애드바이스랑코 낸 바니 아로바 안투니 아독 소르카리니 남급파 방아 페실리티스랑코 와 먹나 아가낸 바니 징아 원방코 다알로 홈 딜리버리랑 카나마나 비비라보 다알로 징니 송오 마그파랑 따랑바 야블시바 미자블시랑오 홈 딜리버리 카그브랑 동자 하금간 호스피탈 딜리버리 카그브라 옹하 앞선다겐 송오노코 아치아오니 아우치 비지슈나 남급바 비사랑 금간 틱탁 옹에 비지랑코 슈아하 아로바 앞선다겐 다오징아 테넨스 프레그넌시랑코 방아 증리 테넨스 프레그넌시 바 중기자 불시 중기자 지가시아 아그바랑코 장팽나가다 락급바 자쿠디 아니랑코 데잉아 아로 베벤다 알로 증리 송오 중기자 불시 중기자 지가시아 아니랑 다오드페 동자하 안데기 증리 락비 BHC니 그다 감카 아니지 증리 송오 아리타 सक्सेसफुल 옹아니 증리 제콘칭아 미션 돈인 바네 제콘칭아 타겟 돈인 바네 감카 와랑 सक्सेस 옹아니코 증아 늑나가다 마나하 알바 앞산드겐 야노 증코 닥착급파 증리 리더랑 증리 오피서랑 증나 블롱엔 닥착하니코 아로스 키아니랑코 나하 증아 느기 앞산 크림코 감캔 바네 증아 닥바 सक्सेसफुल랑코 옹나가다 마나하 베벤 이니 고사코 야코 सक्सेस 옹나가다 증리 아독니 소르카리 아로바 헬스 미니스터 아로바 치프 미니스터 아로바 만디기 IAS DC랑 아로바 헬스 오피서랑 증나 낙바 남급바 송어놓고 전기탕은이 조랑코 seng-baljokani랑코 나니 셀사 징하다오 낙바 위안이 아로바 낙바 전기탕은이랑코 만나하 우니면 앙아 등상만차 증리 아독니 고통에 들링바 안탕코 송리 녹니 만들랑나 온강이 카사비 감코 가인급바 증리 파급바 파 곤락 상마코 앙아 모텔나다 구숑비아 앞선다겐 증리 마담 엠프렌 링도코바 우니 범첩베 증리 송니 만들어나 바 이스카실 잔티아 힐스 아루 가로 힐스 제 송라옹 치나 송랑고 도 송동인pa mandirangna seng-baljokani aro dingtang facilitiesrangko kamaini ungzamaina aro chaarangni ungzamaina aro health ni kita ungzamaina chingna bia dakchakanirangko ninga yarangna plakon anga plak officerangko aro ministerangko metelnata kusi ungbia sakantikon metlani kacharangko agani angni khandikpigipa agananiko inon macharata kusi ungbia i Meghalaya song tangbangchina.
Of village health councils and all the members involved in it. Your hard work and zeal to the cause of saving lives is really an inspiration to all of us. May you go from strength to strength. Ki village health councils yongi, ki the court yong ka village health council. Ayung in ong pat na kalyang ka jongi, Henry. Nishu, ka jing tre shi tom jong pi, ban ai jing im ki wei pat. Ba iwe imen siem re indum do ibang ila aban sumar ka ai men siem shishayangi bat ngida kermen bau blay undang kerkui ni kecing tray ke chong pi bat pen nang ya chaprang kat brang wan kisngi bat kipor. Now we will have the awards distribution for the VHC and TB program, and we request our Honorable Chief Minister and Honorable Health Minister to kindly do the honors. Sir and Madam, if you don't mind, we will be having the presentations in the front. Yes. Yeah, Dr. Mary, please.
We will now have the time of award distribution. In the words of Nelson Mandela, he says, "I have always admired men and women who used their talents to serve the community and who were highly respected and admired for their efforts and sacrifices, even though they held no office whatsoever in government or society." We want to acknowledge and appreciate at this time. The awards are being given to appreciate and to motivate the works and the initiatives the VHCs have taken to do differently to serve in their community. They have been nominated based on their active participation through regular meetings and new initiatives. Total 22 VAs have been nominated today. Now, as the dignitaries are standing here, may I request the representative of the village health councils to come up as I call one by one to receive the awards. May I first call the East Jaintia Hill team, Sokanpur VHC and Tuberkamai, followed by Wasannon Latmorong VHC from Ribhoi, Sokanpur and Tuberkamai VHC from East Jaintia Hills, followed by Wasannon and Latmorong from Ribhoi. May I request the East Khasi Hills and West Jaintia Hills team to be ready as well? Wasanon VHC and Ladmarong VHC from Ribhoi. Wasanon and Ladmarong. Followed by East Khasi Hills, Mosadang VHC and Lightkerhong VHC. This will be followed by West Jaintia Hills VHCs, Pante and Lamin VHC. May I call Japung VHC and Mokhan VHC from West Khasi Hills? Japung and Mokhan VHC. This will be followed by Nongba, Marshallong VHC, and Mopulun VHC from Southwest Khasi Hills. Pante VHC and Lamin VHC from West Jaintia Hills. Jampung and Mokhan VHC, West Khasi Hills.
See one more. Yes,
I have to mention.
Then?
Japung and Mokhan VHC. This will be followed by Nongba, Marshallong, and Mopulun VHC from Southwest Khasi Hills. This will be followed by Chambagre VHC and Amongre VHC from West Garo Hills.
Because you all come on now. Just only-
Nongba, Marshallong, and Mopulun VHC.
Faster, you just see sweep after this and you announce, okay? Then they have to come. Otherwise,
Chambagre VHC and Amongre VHC. Chambagre VHC from West Garo Hills. Amongre VHC. Baispara VHC and Baksapara VHC from Southwest Garo Hills. Amongre VHC.
yeah, they are there. Okay, that's Amongre. Now next.
Baispara. Baispara VHC and Baksapara VHC from Southwest Garo Hills. Rongsa Awe VHC and Balpakram VHC from South Garo Hills. Rongsa Awe and Balpakram from South Garo Hills. Rongsa Awe, Balpakram, Dujong Akhong and Kharkuta from North Garo Hills. Dujong Akhong VHC, Kharkuta Songatal VHC from North Garo Hills. Kharkuta Songatal VHC. This will be followed by East Garo Hills, Chiogre and Jamge Subcenter VHCs. Chiogre VHC and Jamge VHC from East Garo Hills. Yes. Chiogre VHC and Jamge VHC from East Garo Hills. Yes. Over. Shall we all give all the VHCs a big round of applause? Thank you. Now may I hand over to Dr. Emika to continue with the TB awards.
A good afternoon to our Honorable Chief Minister, Shri Conrad K. Sangma, our Honorable Health Minister. Sorry, sir. Okay, so as you all are aware, under the able leadership of our Prime Minister, Shri Narendra Modi, we are committed to eliminate TB by 2025, which is 5 years ahead of the global target. And as we race towards the elimination, the goal seems impracticable without community participation. About a year back, on September the 9th, 2022, the Pradhan Mantri TB Mukt Bharat Abhiyan, a community support towards TB patient, was launched by our Honorable President, Srimati Drupadi Murmu, with the objective of mobilizing the community to come forward to adopt TB patients and support them in the form of nutritional support, nutritional supplement, additional investigations, and vocational support. Today, this campaign has become the world's largest crowdsourcing initiative for nutritional support to TB patients. So on this auspicious occasion, we would like to honor all those who have contributed to make this campaign a great success. For our first award, I would like to call, the first award would be for the, so I request all our awardees to please be ready on the side. So the first award goes to the best performing district achieving the highest number of Nikshay Mitra. And this goes to West Garo Hills. I request the DTO West Garo Hills, Dr. E. Litha Sangma, to please receive the award. Congratulations, West Garo Hills. The next award is for the Best Nikshay Mitra under the category of corporates, and this award goes to Star Cement Private Limited, East Jaintia Hills District. Please come forward, Star Cement Private Limited. Congratulations, Star Cement Private Limited. The next award is for the Best Nikshay Mitra under the category of institution, and this award goes to Missionary of Charity, Nongpo, Ribhoi District. I request DTO of Ribhoi to please come and take the award on their behalf. Congratulations, Missionary of Charity. The last award is for the next and best Nikshay Mitra under the individual category, and Mr. Wanrap Karumnod from Jayao East Khasi Hills is awarded. Congratulations, Mr. Wanrap. Now I call upon Ms. Stacy Pasa from the MHIS division to please continue the ceremony.
Thank you, Madam. Good afternoon. Today, we are commencing the Aapke Dwar Ayushman Drive 3.0, where left-out beneficiaries will be registered during this 3-month period drive. I would like to call upon the following, who are amongst the first beneficiaries to be registered under the drive. Smiti Omila Sun, Smiti Bibu Sun, Smiti Deepika De, Smiti Soma De, and Smiti Caroline Pakenton. Thank you.
Thank you, sir. Thank you, madam. We have come to the end of the award ceremony. Madam, I hope you don't mind, but we will have to call you to give your speech, ma'am.
Honorable Chief Minister of the Government of Meghalaya, Shri Conrad Sangma sir, Principal Secretary Mr. Sampat Kumar sir, MD Mr. Ram Kumar sir, DHS, all the three of them, friends and attendees of this very important launch of the program Ayushman Bhavan. With your permission, sir, may I speak in Khasi? Kanigrigasngi kabadon kambahayangi, hakabakari India Baroh kaway, hakajingyalam jong ka President jong kari kajongi, ngilala bangin play perda, ya kata ka program ka bangiong ka Ayushman Bhavan. Kane ka scheme ka batmu, manra ya ka kot ka Khiah, hakijingkang yeng jong kinong song snong. Kane ka scheme ka tmuru bangin rat ding kong ya ka jingdu no jong ki mensim ki bakordor jong ki kme ki bakhaklung bat ki khon ki jong ki. Kane ka scheme ru ka tmu ban pen bang ki nong song snong ki yo ya ka kot ka Khiah da ka bakilen Shaki centers ki baper limba ki VHCs lani kita ki village health councils ki bapenyan da ki nong penyan snong ban yo ya ka jingtip ka bakham shai hakapor bakem jingpang kamed ka jongki nga ai kublai shi hajar ngo ya phi ki nong penyan snong dai mo phi kita ki champions ki bala ban penlong snam penlong do ya kane ka jingthmu ka babha jong ka sarkar ka jongi dai ma phi ki ban yarap yingi ban pen ba ki kme ki ba armed ki yo ya ka jing sumar ka bapura bat ka bapaka ngi kwaru ya phi ban ra sha ki dong ki shnong ki jong phi ya ka jing koridor jong ki shi hajar kali ki sngi jong ki khur ne ki kelung ki badang suka ngi kwa ban yo i bangila rengkat da ka jing ya trai lang ka jong phi ban khmi bat ban pet baki khon klem pat biang ka pura ka snem kerta ka jong ki kinum yo khon bat kinum penlen no ai ya ka jing im ka bakordor ka jong ki dei ma phi ki ban yarap yingi ban pen phariang ya ka ta ka thma persha yo jing di bu a jong drugs pat ka kyan dei ma phi ki ban yarap yingi ban pen baki shnong ki thau ki long ki shnong ki thau ki bakot ki bakhya ki village health councils la ito da ka sarkar kami bat ngi na kalyang jong ka sarkar jela ngin ai ka kti ngin ai ka jingyarap ka bakerpang yapi ban yarap lem yangi hakidong ki shnong ki jong fi ngi kwa ban pen baya kata ka MHIS card iwei pa iwei inong shong shnong day ban yo ban talem kata ka ban ong bangilala ban mang ya kata ka universal coverage lani kata ka ban ong ma iwei pa iwei ibapang ha ka jela ka jongi in yo ya ka jingyarap jong ka MHIS lem ka jingyarap lem ka jong pi le se ka ne ka scheme kanum la ban poi shaki tnom yeng bat ki tulong jingkhang jong ki yeng ki sem ha ka ni ka jela ka jongi long ma phi kita ki nong yalam ki ban yarap ya ka sarkar ban ra ya ka kot ka Khiah shaki nong shong shnong Baroh
ngas ngau ba ngi don kam ka jing yarap jong ki shnong ki thau namar ha ki taki katas nem ki san phawai snem ki balalen kata ka kot ka khia kampat la ban rat ding khong ye ki jing pang ngi hap ban pe ba ye ka tibi ka badon ka jing khmi ka bakerpang ha ka ni ka skim on la ban rat ding khong ngi don kam ban pe ru ba kata ka regular check up lani iwei pa iwei I nong shong snong day ban yo ya kata ka jing don kam ban yo ya ki tes ki ba pher ban ya rap ya phi ban khmi ban pet ban em ka jing em ka ba bit ka ba byang kani ka scheme ka long ka scheme da u pat ba ya u pat ba ngi ka sarkar ngi day tang ki nong ya pedeng ha kani ka jing penya jong kani ka program bat la da ma phi shim ti ya kani ka kam ban trei ya ka nadu ka donot ka jong phi ngangen ba shen ha ka jalla ka jongi ngin la ban penur long ya ka jing po sneu jong ka sarkar jongi ha ka jing yalam jongi chief minister badon borom jongi iba Conrad sangma ban ped baka state ka jongi ka ya chakman ha kita ki health indicators ya rab lem yangi ban penur long ya ka ne ka jing thmu ka ba ka jongi bat habang ni wan ha ka ne ka sngi to ai baka num dei tang ka sngi ka ba suple perda ye ki schemes ki ba klem la ban long do long snam ha ki shnong ki thau ki jongpi la phi dei ki village health centers ne ki UHCs ki urban health centers yarap yangi pen poi shingi ki jing pen tip ki jing don kam ki jongpi bat ngangen lada ngi trei rengkat bat upat ba kanum la ban long ban pen urlong ya kata ka jingtmu ko babha jong ka sarkar kit bok kit wang ya pi Baroh kita ki VHC's members UHC members shim Khiah ya kani ka kam but ngan nget ba nang ni shakmat hakisan snem ki ban wan ngila ban ai ya ka kot ka Khiah ka ba khambit khambyang na ka benta ki nong shong snong ni don kam bangin rat ting khong ya ka jinget bit kita ki jinget ki bala ban penpoi ya ki khun ki jongi ha jing ma ni don kam ban pet ya ki vaccinations iwei pa iwei iklong ha ki shi hajar sngi balamang day ban pendep ya kita ki vaccinations ngila dep launch ya ka wei pat ka scheme ru ha ki ni ki kendet sngi ki baladem ha ka ba phila ban let shaki centers ki ba pher ban shim ya kita ki vaccinations kam tam le hadin ka jing pang klam kobik yo dang don ki khun ki jungi ki ba khlem la ban pendep ya kita ki vaccinations jongki ngamla khlem da klet ya ka senyang jongki ashas hakane ka kam ka ba kraw shi hajar ngo ya phi ki nong trei asha ki ba trei shit rehem ya kani ka kam ringkat pat ki nong penya chnong ringkat pat kita ki mid level health workers ngin sala ban pelong ya ka jilla ka jongi ka jilla ka ba kot ka ba khia ka jilla ka ba khmi ya la de mat pet bangin ya da ya la de na ki jingpang ki ba pher sau dong jongi tang de ini jing ai jing mot jonga ai ku ble ya ki officers ki bla penya ya ki ka kam shakmat ban ngangen bangin sapoi syakata ka thong hakini ki snem ki banwan hakabanga kum ka mentri jong ka kot ka kya da ka jing sarong ngan ong klem don ka jing do jong ki mensim jong ki long kami hakapor bagi kakun klem don ka jing do ya ki mensim jong ki klung ki bakha bat ki bangi dei ban ri kendong bakin he kin san kin plung kin bha kin mian ha ka jing im ka jong ki tang de ki ne ki kentin shi hajar ngo ye phi shi hajar ngo khuble mithila jai hind
Thank you so much, Madam, for enlightening us clearly about the concept of this campaign in our local language and also for touching on the important health issues of the state and the assurance of all the help from the government to improve our health indicators. Now we have come to the most important part of our program today. We will have the address by our Honorable Health Minister, Government of Meghalaya, Shri Conrad K. Sangma. Sir. Sorry, sir. Oh, sorry, sir. So I'm sorry, sir. I'm so sorry.
As Chief Minister, I'm responsible for all departments, so I take that as a compliment. My colleague and our Honorable Minister for Health and other important departments, Kong Amperin Lingdo, our senior officials, Mr. Sampat Kumar, Mr. Ram, and all our other officials, the DHS, MI, and other directors, and other officials of the health department, all the officials from the districts who have come here, all the ashas, all the different members of the village health councils, and all my dear friends, ladies and gentlemen. At the very outset, I would like to congratulate the NHM and the health department for organizing this very, very important program. And as you are aware, this is a program where we are today launching a 2-week Ayushman Bhava program, where different activities will take place at different levels in the village, district, and other centers to mark a 2-week program which will end on Gandhi Jayanti. And specific missions have been given to different states to perform. And hence, we are happy with the launch of this Ayushman Bhava mission. And I wish the department and all the team the very best. While I say that, as a government, I was just in one of the schools before this program, and I was reminded about a statement I had made a few years back, saying that no development is complete if it is not inclusive. And when I made that statement, I meant it, of course, as a statement and also in terms of the vision that our government has had for the past 5 years and the vision that we have for the next 5 years. And hence, it has always been our objective and our endeavor to ensure that important sectors, because no matter what roads we have, no matter what buildings and large offices or infrastructures we have, if we are not able to provide the basic health facilities at the grassroots level, then we are not being able to achieve a complete development and a proper governance at the grassroots level. And hence, to be able to achieve that development aspect, making sure that proper health care and service is provided at the grassroots level is equally important as providing road connectivity. Likewise, other social sectors like education, likewise other social aspects, socio-economic aspects like farming, agriculture based. If you look at the way in the last 5 years we have worked, we have ensured that we are able to target and have programs that are specific to different social sectors, different communities, different regions, and target different issues like health, education, and farming at different levels so that we are able to achieve that holistic and inclusive development that we envision to do in the past we had done and we continue to do in the future. And when it comes to health services, of course, we realize that it's not just the government. And we all need to realize it. Health starts off at the house of an individual. It starts off with basic practices of hygiene that we maintain at the house level. The kind of cleanliness and hygiene and other practices we have at the village level. The other activities that we take place maybe at the regional level. And hence, at every stage in the different sectors or levels of society, all have a role to play if we would want the health sector to be able to deliver the kind of services and make sure that every citizen in our state is healthy. And hence, involvement of stakeholders is important. So I'm very happy to see today that we have our Ashas who are here. As you know, for the Ashas, we have been working very hard in the last 5 years, where maximum of the dues to the Ashas have been cleared. Not only that, we have also ensured that the way in which the Ashas remuneration is given to them has been smoothened by the use of an app which immediately records all the activities that are being done. So we are doing reformation and ensuring that all the support that needs to be given to the Ashas is being given. We have come out with the village health councils because we realize that without community participation, we will not succeed in this endeavor of ours to ensure that we provide good health services. And we heard testimonies from different villages on how the village health council has really been very, very effective at the grassroots level because we are a society which is based on communities. It is one of the foundations on which our society has moved in the past, and we trust the community-based system and we work through community-based system. And hence we are only leveraging the advantage of this community-based system to ensure that health services also are provided at the grassroots level. And as was announced before I spoke also, that from this year onwards, we will be transferring 20,000 rupees every year to every village health council which is actively working. Now, this is a very important thing because this money will be at your disposal. This money will go directly into your account to allow you to use this money to be able to support the activities that you do at the grassroots level. To make things easier for you, we have even prepared a manual, a small SOP, the small book that you will be maintaining on what you should be doing and how you should be training the villagers, a small manual on every meeting, how it should be done, how it should be conducted. This entire booklet is being given to you, which will make it very easy for you to work at the grassroots level. And not only that, we are converting that into a digital format. So once we convert that into a digital format, suppose you're not able to explain things very nicely or easily and not comfortable, you just simply play the video in local language, which is there on the app, which will be given to you. So not only can you report online, but you can also retrieve videos online, which will allow you to communicate better at the grassroots level. So hence, all these aspects of how the village health councils will transform things is something that we really look forward to. In terms of the investments that are being made in the health sector, you'll be happy to know that Meghalaya is one of the highest in terms of budget allocation when it comes to health. We are number one or number two in the country where maximum amount of budget from the state's budget is given to health department, because we not only are talking about important things, but we are following it up with action, with commitment, and with full financial support. And hence, health is a very important sector for us. And I'm sure that with the efforts that are being made by all of you out here, that we will be able to achieve this goal. It's not easy. There are a large number of challenges we face, and it's not going to be as simple as we would want it. But if we all put our hearts and minds together, if we all are committed to what we are doing, if we all are able to complete the responsibilities given to each and every one of us, I am very, very confident that we will be able to set a great example to the rest of the country when it comes to how community participation can be used and the community can be used and supported in order to provide really good health services at the grassroots level. There are many other areas, as you're aware, whether it is the medical colleges or whether it's the upgradation of the sub-centers, whether it is the upgradation of the infrastructures at the PHC, CHC level, all of that is being done. Just recently, I have also had a very, very important meeting with our health officials, and I have asked them to review the functioning of all the district hospitals, because we are seeing that there are a lot of challenges in most of the district hospitals, be it basic things like facilities, power supply, water supply, medicine supply, equipment maintenance, manpower training. All of these basic, simple measures can actually improve the overall functioning of district hospitals. And hence, we have taken a decision that in the next 6 months, we will be ensuring that a tailored and a focused approach is done for every district hospital, the civil hospitals and different district hospitals, so that we are able to improve the overall functioning in a mission mode in these hospitals. I was recently taking a report of Tura Civil Hospital, which happens to be my constituency. And we were made to understand that there were issues of transformers not working properly because the oxygen plant was not working. Because of that, they had problems with the UPS, and the operation theaters sometimes had backup problem while operations were going on. They had an issue with water supply leakage taking place, and small things which are easily can be rectified. And hence, all these kind of efforts are now being put in, and I'm sure that we'll be able to achieve the goals that we have in mind. Today, as you're aware that even Health Department has started its own recruitment board. And you're aware that through this recruitment board, record 400 plus doctors were appointed in a matter of 2 months. And that has really eased the pressure at the grassroots level. And even in the future now, nurses as well as doctors will be now appointed by this medical board, because obviously MPSC and other forms were taking too much of time. And now the process of recruitment will be really shortened. And just so that I share the government's vision with all of you, we'll be having the recruitment boards in other departments also. For example, education recruitment board is also going to come up, because again, education takes too much of time. We already have the MPSC and other boards also. We will be reforming all of them to ensure that we are able to cut the time that it takes for recruitments and filling up of vacant posts in the state. And hence, all these reforms are taking place. And in the days to come, I'm very sure that the way the health department is moving forward, we will be able to see a lot of change and improvement at the grassroots level. I will take a few minutes just to speak in Garo, because a lot of our friends from Garo Hills also are here. Anika Sara Repingrang, dingtang mansanga ya chol kurayan na simang sakanchiko na matel na kusyo nga. Aro NHM aro health department ni official rang ko ba? Yan ang big pa program ko organize ka nina gisakatong gamagsiya nga matel na kusyo nga. Ayushman Bhav program, yan ang ni Prime Minister Shri Narendra Modi ji ni program nga. Aro yako biya antiganina Gandhi Jayanti na kengkeng October gani tariko na kengkeng antiganina dengtang program rangko sub center level village health council level aro state level program rangko organize ka imong health awareness aro health services rangko na MHIS ni registration rangko bariat na aro yako na me saturate ka na ya plak ko magsonge ya Ayushman Bhava program ko umatinga aro yako na me sukat na na simang sakan chini singa dakchakani nangko aro kumungani ko singa nanggen maina dengtang activities tonga dalo village health council ni level ba activity rang donggen sub center level ba activity donggen asha level ba activity donggen unigaban ya nambega pa program ko sukat na ansing sakan chinin kam ka aniko aro kumungani ko ansing nanggen ya dianggap pa bilsibungani gisepo ya MDA government health education aro antini agriculture sector na dengtang mancha singa gisik nange singa kamrangko kainga na simang sakanchin uya dengtang anchini agriculture department to jekai focus plus program rang ko chunga ngacho anchini education na chinga dengtang government LP school rang ko chinga repair ka aha education commission rang ko chinga thari jok education policy ko chinga bukota ha wan apsan dakke health department to ba panga policy rang ko aro reform rang ko chinga ra painga maina ya sector rang ko anching namme chalaina man jaude namgapa health service ko naman jaude namgapa education ko naman jaude anchini state mamang saloba 100% anching develop naman jawa dalgapa building rang ko namgapa raman ko nanga ande ba yan akpa development infrastructure ko matna baksa anchini health service education aro agriculture ko anching namme improve ka naman jaude nam dapat naman jaude anchini overall development mamung soloba 100% chusok naman jawa uniga man dalo ya maksonganiyo chinga ya dengtang social sectors rango na men chinga dalo gi siknange dalo kamrangko kainga yani gi sepon dalo health department ko na ismang niat po health department to ya village health council ni concept ta suan sini jongpa saksa longe na me biaya village health council ni kam ka ani ko aro yani namgni ko aro ya ko dakachi mai dakpa benefit ko chini mandrang matninga chim ya ko biya na men thale da show biya ga nang ha aro ya nong chumota maina da alo chini society ara community based society chini songo donga pa mandirang chini area ni gaubura nokma headman ni true ching ba kamrang ko ching sugatna matninga uniga man ya health service so ba ching ni muksongani ara ching ni local community ko ching mai dakki health service so involve kana matgen ya muksongani yo chinga ya village health council ko haida Meghalaya India kabmakon haida ya kangapa dakpa program ingen maina gapan state to dakpa program dongcha community level ko involve ka ani uniga man dalo yani result rang blongin naminga aro result namani gaman ya ko mukang chen ching mai dakki aro nam dapat na matgen ya ko muksonge chinga dalo ya belsioni belsiantian chinga hazal kolgruk takke chinga VHC ki antinan chinga belsio hazal kolgruk takke chinga banko na simangni bank account chinga spatken aro ya tangka peserang chi na simang songrango dengtang health activity rangko dakna matgen unbaksa ya health activity rangko ngatna tangkarangko nan baksa ba chinga namgapa na simang na manual ko thariya yan kitab ko na simang na me jakalo de yano maiko dakna nanga badia meetingo mai dakpa program ko ngatna nanga ya program ko ngatura mai dakpa information ko public na ma shet na nanga mai dakki yani record rang ko maintain ka na nanga yana chinga namgappa na simang na manual ba register ko chinga thariyo ta ya register ra likhao ba donga aro online ba dongkin aro online ode na simang jen solo register ka gen ya registration na simani report rang automatically chingni Shillong office na ba Thura office na automatic chinga matnai gen aro ya app pora ya software ro na simang dengtang video rang ko ba chku chiba khasi chiba penar chiba na simang ya video rang ko ba nina matgen aro ya video rang ko public na ba na simang misok na matgen unigaman na main gamchat bigpa ya app nga unigaman ya dakpa dengtang chinga program rang ko dalo ngatinga aro yerang ko ngatachi chinga health sector ko nam dapat na aro reform ka da chinga maksonginga ande ba ya plak chini kam ka aniyo government bangmang chide chinga man jawa government policy rang ko thari na matgen government infrastructure ko thari na matgen app rang ko thari na matgen guidance ko bana simana skeni ko na matgen ande ba community public rang anchini asya rang aro anchini medical officer rang grassroots level o dengtang health worker rang involve just kalde anching mamung saloba chusok na matjawa unigaman ya da ali meeting on asman na matgen minister sa nongja dalga pa officer rang sa nongja indi ba asha rang ba donga village health council ni member rang ba donga anchini dengtang district ni officer rang donga ya maksongani ra ya anchini health sector ko improve ka na de anching sakkan chinin kam onga anching responsibility ko aro role ko anching ra jaude anching health sector ko mamung saloba nam dapat na jawa uni man iya ko ma sien dalo ya program mo tentang tsinga sektoroni leveloni NGO rangko organization rangko asha rangko VHC rangko member rangko kemak kon dalo kami meng hayan tsing bongna aro hayan tsing nam gapa maksonganiyo jedak kode antsing ya health sector ko antsing reform kana mat gen nambat gapa antsing service rangko namat gen ya maksonganiyo antsing monge kam ka na ane anga ya chol kurai simang sakan chikon anga mola aro ya programo attend ka nina anga na simang sakan chikon gisa ka tong makchi matel na bakusyo wa. So my friends, with these few words, once again I would like to congratulate the NHM for this great initiative, and I foresee that in the coming months and the coming years, we will see a huge transformation in the health sector. We are seeing bits and pieces happening everywhere, like a simple thing like the Safe Motherhood program that we have. You'll be happy to know that the MMR has gone down by 40% in the last 5 years. It's a huge and the biggest transformation that our state has seen in terms of mothers' lives being saved. I hope the day will come when not a single mother will have to lose her life while bringing a life into this world. And that is the kind of objective with which we are working and the passion with which we are working. And for this to happen, it is our duty, not just government, but each and every one of you present in this room. When there is passion and care and commitment from our side, anything is possible. And that's really what I would like to give that message to you. Let us work together today. Government is committed like never before. We have a plan to move forward in a very, very structured manner. We have laid the foundation in the last 5 years. We will go ahead with our work in the next 5 years. It is rarely, I don't want to say it and mean it in any wrong way. Please don't take me otherwise. But for any government, continuity of government is important for policy making and for implementation. And Meghalaya is seeing that continuity after quite a bit of long time. And hence, we are hopeful that the foundations and the policies that we've created in the last 5 years, that we will be able to continue that work in that direction with the same and even more commitment in the next 5 years to be able to achieve those targets that we have. Our state is not very big. We have, 7 lakh households roughly plus minus, about 6,000 plus, 5,000 plus, 6,500 plus villages. Very much doable. We can easily reach these goals if we want. The commitment is there from our side. So with these few words, I once again thank all of you for being here. I once again congratulate our minister, a person who is one of the most passionate and aggressive and active ministers in our cabinet, not saying that others are not, but she has been very, very active in terms of going to the grassroots, understanding the problem first, and then coming out with a solution, rather than just sitting in Shillong and trying to come out with policies. And that is really how we should try to resolve problems, by understanding it first, seeing it with our own eyes, assessing it properly, and then suggesting what should be done. And I thank our Honorable Minister for all her efforts, and I'm sure that under her leadership, we will see a huge transformation in the health sector. So with these few words, once again, I thank you, I congratulate you, and I wish you all the very best. Kublai Shibun, Matela, and Jai Hind.
Thank you, sir. Our Honorable Chief Minister, Government of Meghalaya. Yes, sir. Improving healthcare at the grassroots level and right from the home is the foundation to a long and healthy life. We are really grateful to you, sir, for all your support, your leadership to the cause of improving health services and transforming them in our state. Now I will call upon Dr. A. Lingdo, Joint Director of Health Services, MCH and Family Welfare, to propose the vote of thanks.
Thank you, Madam. Honorable Chief Guest, distinguished guest, respected colleagues, ladies and gentlemen, I am truly delighted to stand before you all today as we come together to celebrate the launch of the Ayushman Bharat campaign. This initiative serves as a beacon of hope, aiming to raise awareness about the various healthcare schemes and, more importantly, to ensure the availability of clinical healthcare services in both rural and urban areas. At the outset, I would like to extend my heartfelt gratitude to the Honorable Governor of Meghalaya, Shri Fagu Chauhan, for gracing us with his esteemed presence during the national virtual launch event. Your presence is a source of inspiration for us all. I would also like to express our sincere thanks to our Honorable Chief Minister of Meghalaya, Shri Conrad K. Sangma, for his participation in the state launch. Sir, your presence today fills us with deep honor, and we eagerly anticipate the successful implementation of this campaign under your dynamic leadership and guidance. It brings me immense pleasure to extend our gratitude to the Honorable Health Minister, Madam Ampreen Lingdo, for joining us today and for her unwavering support and motivation. I must also acknowledge the invaluable contributions of Sir Shri Sampat Kumar, the Principal Secretary of Meghalaya, Health and Family Welfare, who has been a guiding force in our endeavor to enhance healthcare services. Special thanks to Sir Ram Kumar IAS, Secretary of Health and Family Welfare, Mission Director, NHM, whose tireless efforts have been instrumental in ensuring the success of this program. Thank you, Madam DC, for always being there with us, especially when it comes to the various health programs within a district and even in the state. And Madam DHS MI, Madam DHS Research, Madam DHS MCH, especially also for appreciating for convening this program today. And to our dedicated healthcare team from the Directorate of Health, the State Program Management Unit of National Health Mission, technical partners, JPIGO, UNICEF, MHIS, ABDM, DPMUs, the BPMUs of all the districts under the state of Meghalaya, and the support staff who have worked tirelessly behind the scenes. Your dedication is commendable. Masamanai kubleiru yeki VHC members, yeki ashas, yeki niksha metre, ki MHIS beneficiaries, naga dao ba ka jingwan jong phi ha ka sni ben don ring ka lang bat gi kapani ye kata ka jing shim khia jong phi ba jing ke khle jong phi ban ye don ring ka ban pen e ba ka ne ka program ka long shisha ka ban ra jimen to ye wi pi we ilo nong shong snong jong ka snong jong phi ha ka ba kin yo e ka jing men to ne kini ka program na kan ka campaign ka ban don ha ka arthrek ban yo e ka jing men to kham tam ha ka liang ka kot ka khia ban kin te ye ka em lang ka sala. I would also thank to the media and our communication teams. Your role in spreading awareness about Ayushman Bhava is pivotal. Ki rangba snong rung ikwaban ai kijing ai kuble the nokmas from Garo Hills ki wahe snong the Bojaintia Hills ye kijing 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 kershan kajong phi the kijing don ring kat ban ngi hakene kismi ngang it's kem bakane kan wan ra shisha ya ka imlang ka salang ka bakot ka bakhia. Thank you once again for being a part of this historic moment, and I look forward to our collective efforts in building a brighter and healthier Meghalaya. And thank you, Kublai Shibon, Mithela, Jai Hind.